Minutes for questions, please.
Thank you, Dr. Gottlieb, for being here. Help me understand, basically, we're talking about two different scenarios here. We're talking about drugs that have been approved already by the FDA for something, but what they're wanting to be used for is not an indication, so physicians are trying to use it off-label, if you will. And we're also talking about investigational drugs that have not been approved yet, but are in the pipeline. And am I right in that?
Well, I think that you're right that those are two constructs that exist for patients to get access to unproven therapy. I was a patient who used an approved product in an off-label fashion, and that's actually typically what you see in these settings. You'll see products used, especially oncology. You'll see products used off-label. I think what we're focused on with respect to the legislation here, respectfully, is the second scenario that you offered, which is a product that hasn't yet been approved by the FDA, but patients want to use it in an experimental or investigational way.
Okay, it's my understanding that FDA, your responsibility is to protect the public from any side effects, any bad effects that a medication may have, but also to make sure that it's available if it could benefit the public as well. Is that correct?
Well, I think the scope of the FDA's mission is broader. I think the scope of our mission and our responsibility to patients is much broader in this context. I would tweak it by saying I think our responsibility is to make sure that patients and providers are fully informed of both the risks and the benefits in these settings. Okay,
having said that, can you explain to me why the FDA keeps putting their head in the sand when it comes to medical marijuana? I'm not, and I don't want to hear, well, marijuana is a Schedule I drug for investigational use only. But here we have, I don't know how many states we're up to now that have approved it. Here we have all these states, and most of them with a different strength of what they've approved, and yet the FDA just continues to ignore that. Isn't it your responsibility to address that?
Well, I see people who are developing products based on marijuana making all kinds of clinical claims in the market. I see people who are developing products making claims that marijuana has anti-tumor effects in the setting of cancer. And I think reasonable people can ask reasonable questions about whether marijuana is a chemotherapeutic agent. So, you know, it's a much broader question, Congressman, about where our responsibility is to step into this and start to ask questions about the claims that are being made.
Where does your responsibility come in? It would appear to me, when you've got all these states that are approving it, it would appear that the FDA should be stepping in to give some kind of consistency here.
Well, I think that we'll have some answers to this question very soon, because I think we do bear a responsibility to start to address these questions.
Let me ask you, the bills that we're considering today, how will that change your approach? Will it change your approach at all? Will it change your role in the process at all?
If these bills are passed, look, we look forward to working with Congress to make sure that they're faithfully implemented. It will open up a new vehicle for patients to potentially get access to certain therapies. I think the question that I outlined throughout my testimony today still remains about whether or not sponsors will offer these opportunities on any greater basis, and whether or not this legislation alone is enough to compel sponsors to have supply available to offer products more generously on an expanded access basis. I think that those questions remain unanswered. I don't have an answer to those questions.
Two more things real quick. First of all, you've read over the legislation, I assume, that's being proposed?
Certainly.
Is there any part of it that you think that the FDA potentially could have trouble because understanding or implementing? Because what I don't want to happen is to have legislative intent interpreted by the agency when that's not what we were intending to do.
Well, I mean, I've outlined some of the places.
We've had that experience before in other areas.
Right. Well, look, and legislation can be interpreted differently by different FDA commissioners as well, as you're well aware. I've outlined some of the areas where we think that there might be ambiguity in the current language right now, where Congress might take closer consideration of how certain things are crafted and how certain things are worded to potentially tighten this up. And we've tried to be constructive. We'll continue to try to be constructive and work with Congress if this legislation does advance.
Okay, one last question. I go back to my question at the beginning. I am to understand your answer about medical marijuana is that FDA is going to be addressing that situation very soon.
Congressman, the question is, should we be taking enforcement action against people who are making certain claims in the market? Because I don't necessarily understand your question. We have 20.
My question is simple. Why does the FDA continue to ignore medical marijuana when we have states who are approving it? We have states who are actually taking on the responsibility of approving medication.
We have two frameworks that we operate in. One is sponsors who bring us applications requesting that we approve a product for a certain intended use. We have 20 INDs and active INDs in-house right now that are for marijuana products. They're typically for marijuana extracts because delivering an active pharmaceutical ingredient through inhalation isn't always the most efficient route. The other question that gets to your question is whether or not there are certain claims being made in the market by people who are marketing marijuana in interstate commerce that are unapproved new drug claims and could potentially put patients at risk. That's a separate question. I think that we will address the sweep of these questions in time, including the questions put before us from sponsors that have 20 INDs.
I mean, can I get some kind of idea of when you're going to address this?
Well, we have 20 INDs in-house, and so we're addressing those as part of our review process.
Do those 20 INDs have all these states approving them already?
These typically are sponsors who are putting products through, trying to put products through a scientific process and not just marketing it on a website.
And the chair would advise there's likely to be a multi-agency approach to this. It is not going to be exclusively through the Food and Drug Administration.
And that's well understood, but certainly they have a role in it that I feel like they're ignoring.
And the gentleman's time is expired, and the chair will recognize